Hello everyone and welcome to the 12th edition of Spotters and Boosters. Here we'll focus on cracking MCQs for learning pharmacology. The solutions for the SDL 11 which were given, one question was basis of use of ceftriaxone as first drug of choice in typhoid fever. Now the appropriate answer can be ceftriaxone is a third generation parenteral cephalosporin with a longer half-life and good tissue penetration. So it is given once or twice daily. It is effective against fluoroquine resistant strains of Salmonella typhi, and when given for the treatment of enteric fever, the duration is usually 7 to 10 days of therapy. It is used in typhoid fever preferred because the fecal carriage rate is less than 3%. So it reduces carrier state and it also reduces relapse rates to 3 to 6% only, and as against patients who develop chronic carriage state with the use of ciprofloxacin. So comparatively efficacy is there, and this drug later on we will understand is more safe. However, ceftriaxone is secreted in bile, it is concentrated in gallbladder, and actually gallbladder, the salmonella reside in the gallbladder. Therefore, reduction in carrier state is explainable. However, because it is concentrated, it can produce biliary sludge and stones. This is called as pseudocholelithiasis. Now, by the way, which is the other cephalosporin which is effective against enteric fever? The one which comes to my mind is cefoperazone, which also has a high biliary secretion. There are two questions. One is, why is chloramphenicol not used nowadays, and how does ciprofloxacin act? If you see the mechanism of action, cipro is a bactericidal against Salmonella typhi, whereas chloramphenicol was effective and bacteriostatic. Ciprofloxacin, when used as a first choice, produced quick defervescence of pyrexia as compared to chloramphenicol with reduced relapse rate, and currently it is also used for elimination of the carriers, but the therapy is much more prolonged. The limitation of ciprofloxacin is emergence of resistance, and the same limitation precluded use of chloramphenicol with high level of resistance, and there is less relief in the carrier stage of the patient. Now the more important is ADRs. Chloramphenicol produces serious bone marrow depression in the form of granulocytosis, neutropenia, or aplasia, and this is perhaps the major reason chloramphenicol use is declined, and there is a high relapse rate because it does not much affect the carrier state, has to be given for a very long time. Therefore, ceftriaxone is a drug of choice. Ciprofloxacin can be given in areas where level of the prevalent resistance is low, but chloramphenicol is not. Question 2 is, an antimalarial which is occasionally used IV may produce profound hypoglycemia. Quinine hydrochloride is not currently used because of level of resistance and availability of artemisinin in derivative, but when used can produce profound hypoglycemia and black water fever. An antihypertensive formally used intravenously for rapid reduction of severe hypertension may cause hyperglycemia, and currently it is orally indicated in the treatment of insulinoma. Answer is diazoxide. Diazoxide is not primarily currently used for severe or malignant hypertension, but orally it is recommended for treatment of hypoglycemic episodes due to insulinoma because it produces hyperglycemia. Question 3. Why is praziquantel contraindicated in the treatment of ocular cystic cirrhosis? The answer is inflammatory reaction of the dying cystic cerci may jeopardize vision by damaging eye, and therefore neither praziquantel nor albendazole are used. Ivermectin is preferred compared to these two drugs. Now, question 4. Segregate anti-diabetic drugs into two groups, hypoglycemics and euglycemics. And also segregate them weight losing agents, weight gaining agents, and weight neutral agents. And here I have tried to segregate them. Hypoglycemic anti-diabetics are insulin, sulfonylureas, postprandial regulators, GLP-1 agonists, DPP-4 inhibitors, and SGLT inhibitors. But remember, insulin, sulfonylurea may cause hypoglycemia much higher level than the remaining drugs. Euglycemics or anti-hyperglycemic drugs are metformin, pioglitazone, and acarbose. Acarbose, no, the asterisk says that alone they will not produce hypoglycemia. They just reduce the elevated sugar. But along with other drugs, they may cause hypoglycemia or aggravate hypoglycemia. Other which it doesn't have to do anything with the blood sugar directly is bromocriptine. Now the second segregation is those drugs, anti-diabetic drugs that cause weight gain, weight loss, or are weight neutral. Insulin, pioglitazone, sulfonylureas may cause weight gain. Metformin may cause weight loss or may not cause, but causes. GLP-1 agonists also cause weight loss, and primarily semaglutide is promoted for weight losing agent currently. Weight neutral are DPP-4 inhibitors and SGLT2 inhibitors. Although in some it may reduce weight because there is. And the last question was the relationship between the worm infestation and disease and drug of choice. Bladder cancer, squamous cell carcinoma, cystosoma, hematobium. Praziquantel drug of choice. Although carcinoma should be treated in other way also. Severe iron deficiency anemia, hookworm, enchiduodenal, Necator americana. Mebendazole, albendazole. Vitamin D deficiency can be called fish tapeworm, D. latum, praziquantel plus B12 must be treated. Convulsions are usually caused by neurocysticercosis, tinea solium. Others are there, but albenda and praziquantel are the drug of choice. Blindness is caused by oncocerva, river blindness, volvulus, ivermectin should be choice. Intestinal obstruction is usually caused by heavy worm burden of ascaris, and usually patient may require liquid form of the drug, piperazine, albendazole, mebendazole. If not relieved, then surgical removal need to be done. Myositis, muscle involvement is common in many worms, but trichinial spiral is caused myositis, and albendazole is a drug of. Now, in this new session, few MCQs which you have to crack down. An aminoglycoside used for leishmaniasis. 4 choices are there. Find out the right answer. Question 2. A beta-lactam antibacterial drug effective against gram-negative organisms only. So all are beta-lactam given below, but one of them is effective against gram-negative infection only. An antimicrobial drug that has gastric prokinetic activity. Choices are erythrodoxyclindalinase. Find out and give the correct option. A steroidal drug used as antibacterial topically. Mupirocin, fusidicate, neomycin, all are topical, but one of them is steroid. Gastric acidity is required for anti-ulcer activity of all are anti-ulcer drugs, but acidity is required for activation of one of the drugs. A preferred agent for prevention of nausea, vomiting, early pregnancy. The 4 options are there. One of them is widely used and is found to be relatively safe, although no drug agency. This urinary anti-infective drug has shown low resistance despite continued use for E. coli infection, and you have to identify. NFT, Norflox, Clotrimer, and Cipa all are used for UTI. Hyperuricemia is an adverse drug effect of the which drug? All except losartan, pyrazinamide, chlorthalidone, and low dose. An antifungal azole effective against mucormycosis. All are azoles, some topical, some parenteral. You have to find out. Question 10. A macrolide antibiotic that is used as an anti-H. pylori drug and anti-H anti-leprotic drug, both with one drug, and find out the option among the macrolides or related drugs given. A single dose of this drug is indicated for the treatment of uncomplicated cystitis in women. These are all used for the treatment of urinary tract infections, particularly upper or lower infection. Lower we will consider. Question 12. A preferred antipsychotic drug to treat hallucinations and delusions in patients with Parkinsonism who is also receiving levodopa. The drug could be one of the given choices. Here, please read out and find out. And finally, the incorrect matches are given for the drug and their liver injury they are causing. You have to find the correct matches by studying the entire text from the book. So it will be a session on self-directed day, and find out the answers and then to revalidate or verify and see explanations. You can visit next episode of the spotters and boosters. Thank you. Happy learning.